Good afternoon, everybody. So today, as a part of TMA's webinar series, we are in for the AI in transfusion medicine or artificial intelligence in transfusion medicine. So AI in transfusion medicine is a very new and exciting area of interest, and it holds the potential to transform this our field of transfusion medicine because AI can help to enhance decision making, it can boost the efficiency, it can improve the patient outcomes, and it can do anything from forecasting blood shortages or going in for optimizing donor matching to automation or whatever we want in our day-to-day activities. So AI not only is a tool, but in fact, it is becoming a partner in day-by-day activities world over. So today we have with us a young, vibrant transfusion medicine professional who is none other than Dr. Arun VJ, who will take us through this AI in transfusion medicine. So a few words about Dr. Arun. He is a consultant in the Malabar Medical College and Hospital and Research Center currently. He is the ISBTI Dr. J.G. Jolly Award winner, and he is also the author of the website thirdthinker.com. He is a resource person for developing blood center information software. He is a part of the ISBT IT Working Party as well as the Donor and Donations Working Party. He is currently the editor of the TMAS newsletter and ARDP International Outreach Committee member. He also has obtained the Transfusion Research Young Investigator Training Grant from the ISBT, and he is also a gold medalist of the MD Transfusion Medicine from Kelly University of Health Sciences. And he also has multiple publications in national and international journals. So definitely he is the person to discuss AI in transfusion medicine with all of us. So may I now hand over the criteria to Dr. Arun VJ.
Thank you for the kind introduction. I hope my slides are visible.
Yes, it is visible. It's in minimized form.
What about now?
Okay, visible now. Full screen.
Slide
Please
is
go ahead.
changing, right?
Yes. Please go ahead.
Greetings, everyone. At this outset, I would like to thank Transfusion Medicine Academic Society for giving me this opportunity. So my topic will be AI in transfusion medicine. As you can see, this is my first slide. It's actually generated by an AI software called Gamma. So I just gave the prompt of AI in transfusion medicine into that Gamma software, and it had given me a set of PPTs, and this is the first one. So on the left side, you can see an image generated by that software just from my keywords. Now they have tweaked the title a little bit. It had added something like revolutionizing blood safety and efficiency. Then it has given a small 2-line description of the topic, and this taken my name and also my display picture from the Google account that I used to sign in with it. So just from typing 3 or 4 words, this PPT was generated. Now let's go to a man-made PPT. So I made this PPT by myself by doing how we routinely prepare for a presentation. So the topic is AI in transfusion medicine. So I have no conflict of interest to declare. The only thing is that I am not a software engineer. I am not someone who works in an IT field. I am a doctor who practices transfusion medicine, who is just an AI enthusiast. So let's go through the journey of blood. From ancient times, we knew that blood was very important. It was the essence of life. We knew that. So we tried drinking it. We tried bathing in it. So we tried everything. Nothing didn't work out. We tried transfusing, but most of the patients died. So then Carl Einstein discovered ABO grouping in the 1900s, and that changed our field. Then later, as time progressed, cross-matching was identified. And recently, our young specialty of transfusion medicine has come about. Now, we are automating everything. We want automated systems in all our labs. Now, with the advent of AI is going to be integrated into all our blood centers, whether we like it or not. So just to look at the Industrial Revolution as an introduction, you can see that the first Industrial Revolution was in 1780s by the invention of steam engines. It took about 120 years for the next Industrial Revolution to come about, which was mass production and assembly lines with electricity. Then it took about only 70 years for the third Industrial Revolution. It was with the advent of computer and automation. Then again, within 30 years, that means that every industrial revolution is getting faster and faster. In the fourth industrial revolution, it was about internet and cyber physical systems. Now we are at the cusp or the transition of fifth industrial revolution, which is human cyber physical systems, and AI is going to play an important role in it. So we know that wars having fought for oil. We have invaded countries, we have destroyed countries all over the world for the resource of oil. Now, data is the new oil. It has become the primary resource that drives our economy. So all these companies are competing for our data, our viewers and my personal data. So whoever controls the data controls the future. They decide what we like, what we do not like. That's called social engineering. So just a throwback, back in 1986, there was a group of mathematics teachers protesting use of calculators in school. So there are some people who cry about use of AI in all the fields, but AI is here to stay and it will affect us all. So there is no going back once AI is here. Now, there are different terminologies associated with AI and machine learning. So these are the three most common terminologies we'll see: deep learning, machine learning, and artificial intelligence. Just briefly look at the definition and an example to understand easily. So artificial intelligence means the ability of a machine to imitate intelligent human behavior. It's simple as that. So machine learning is application of it. It's a subset of that AI that allows a system to automatically learn and improve from experience. Now, there is something called as deep learning. It's again a subset of machine learning that uses complex algorithms and deep neural nets to train a model. So for the sake of understanding, I believe we are all transfusion medicine specialists. Let's look at the example of platelet inventory in a blood bank or a hospital. So what deep learning does is that complex algorithms and networks to train a model. We feed the data into it and the model trains itself. So the food for an AI or a machine learning is the data we provide. We have to provide
We're sorry to inform that there's a small technical glitch because of connectivity issues will be resolved as soon as possible.
with the patient footfall or the IP or the number of surgeries within the hospital. That's what machine learning does. Now, what does an artificial intelligence do, or what can it do? So again, this 5 years of data is being processed by artificial intelligence, and AI has access to the internet, and it knows that dengue can cause thrombocytopenia, and this thrombocytopenia requires platelet transfusion. So it has identified that from the internet, or we can provide it to that system. Now, AI will look at the incidence of dengue in that particular area or your hospital's area. It will search the government database and see if there is an outbreak of dengue. For example, in my state, July, August is the months during which there is a dengue outbreak and there is high demand of platelet. Now, the AI can understand that this outbreak and this increased demand of platelet is because of the dengue outbreak. And we need to collect more. So one fine morning in July, I will open my system and I sit at my desk at 9 a.m. and there will be a pop-up from AI telling that the first case of dengue was reported only 20 kilometers from your hospital and you need to be prepared. Okay, that's good. And right after 1 week, again, another message pops up from AI saying that now there are 100 cases of dengue and 10 of them are in 10-kilometer close proximity to your center. That means that it will compare the patient population. It will check the government data registry and let you know that so these many patients will come to your hospital or they are expected to come to your center for platelet transfusion within the next 5 days. So you need to increase your platelet increment by 30%. All these can be done by AI without us interfering. We just have to feed it the information, give it access, and just with a click of a button, it can give us all this data. I hope I have given some idea about that. Now, John McCarthy is the father of AI. He coined the term artificial intelligence back in 1956. You must understand what a visionary he was if he able to visualize AI more than 50 years back. Now meet Geoffrey Hinton, is the Nobel Prize winner for physics in 2024. That's this year. He's known as the godfather of AI. So the tools for physics to construct methods that help lay the foundation for today's powerful machine learning. He shared it with someone called John Hopfield. He invented a model that can discover properties in data which can become important for the large language and artificial neural networks now we use. Now there is someone called the godmother of AI. She's Fei Fei Li. She's currently at the Stanford University. Her work on big data was the key factor in the deep learning breakthroughs of the early 2010s. So deep learning, machine learning, and AI, like the diagram I had shown earlier. Now, these are the few of the AI models we are familiar with, or at least we get to see in our day-to-day life. The first one is obviously ChatGPT, which has revolutionized the approach to AI. Then there is Edge Copilot. Then there is Claude AI. Then there is Meta AI in WhatsApp, which appears as a blue ring in your WhatsApp. Then there is Google Assistant, or now it's called as Gemini. Then there is something called Grok. Grok is the AI by Elon Musk, which is inside your Twitter account. So you must have come across some kind of AI assistant during your last few months. Now, so what exactly is AI? So AI refers to computer systems capable of performing complex tasks that historically only a human could do, such as reasoning, making decisions, or solving problems. So it's basically an umbrella term that encompasses a wide variety of technologies, including machine learning, deep learning, natural language processing. So what does our intelligence actually do? Our intelligence discovers the information, we can infer from the information, and we can reason with that information, and ultimately take a decision based on that. So ChatGPT is the most common one that we use. It stands for Chat Generative Pre-trained Transformer. So it's a model that can generate text based on a large amount of data it has been provided, and it's an architecture of AI model. So again, it's pre-trained means that a lot of data has been fed into the AI. So food of AI is data. It's by a company called OpenAI. We must have all heard about Sam Altman, who is the main role in AI. So it has knowledge up to October 2023, but it can limited access to internet with a browser tool. So with the unlimited potential of ChatGPT, what I use it for is to write clever emails and to write reports of minutes of meetings. That's what I basically use ChatGPT for. But there are a lot of other applications. So in an Indian scenario, the CDSCO considers AI as a medical device if it is for patient treatment. So if patient treatment is decided or influenced from AI, then it has to be registered as a medical device. And the ISO 13485 is the global standard for medical devices. You have to abide by it. In India, the Ministry of Electronics and Information Technology will be dealing with AI. As of now, there are very few regulatory issues. One is by the NITI Aayog in February 2021. They have drafted the principles of responsible AI. Then there is something called as draft National Data Governance Framework Policy. But these are just a big guideline or a framework, nothing concrete as such. Now, in the European Union, there is an AI Act coming. And in United States, there is White House blueprint for AI Bill of Rights. So there is only rough draft for almost everything. Nothing is solid, as AI is a new technology and it keeps evolving. So we are not yet sure the boundaries of AI and where should we limit the AI. That's the main issue. Now, coming to the broad topic of AI in healthcare, it can influence and affect all stages of healthcare. Not only healthcare, any field AI is there, but in our specific situation, AI in healthcare, it can be used for diagnostics. For example, in histopathology and in radiology, we have fed thousands and thousands of images of our X-ray films, CT films, MRIs into the AI, and it is able to predict or diagnose the disease and the prognosis even with great accuracy. In histopathology also, if you feel the slide, there are machines which can do prepare smears for us, and it can, if you feed that image into that AI, it will give us a diagnosis or that shows which are the typical cells. It can be used for personalized medicine, drug discovery. It can do robotic assisted surgeries, patient monitoring and management. If it is connected to the electronic medical records, we can capture all the patient data, large amount of history of the patient, and help in patient monitoring and management, administrative efficiency for hospital. It can run an entire hospital. It can do the HR analytics. It can do the patient OPD management, IPD management. Everything can be done. Staff appraisal can even be done using AI. Then there is a field of mental health. Even for mental health counseling, we are able to use an AI if we train it properly. It's still in the development status, but it is a possibility. Now, coming to our specific field of AI in transfusion medicine, we are a specialty that deals with huge amount of data on a day-to-day basis, from the donor side, from the patient side, from the testing side. So, as the foot of AI is data, we are the best department for AI. So, but the thing is that we rely on a method of convenience where each unit is generalized, which is dissociated from the donor once they are donated. That means that are all the donor units same? Because one donor has a hemoglobin of 30 and another donor has a hemoglobin of 16.5. Will both the units be equal? Obviously, there will be slightly higher hemoglobin content in the 16.5 donor bank. So can we consider both the units same? Then again, can we consider all the patients same? So suppose one patient has a hemoglobin of 5 and he is hemodynamically stable, but another has a hemoglobin of 6, but the patient is hemodynamically unstable and bleeding out. So can we consider both the patients same? So hemoglobin is not the only parameter to consider there. So when preparing for this particular webinar, I first went to PubMed and typed in the keyword artificial intelligence in transfusion medicine. So there were very few hits. So I used the Boolean logics and ignore to get more hits, but still it was limited. So I was thought it's a new field, so there might not be that much data available or publication. So I went to something called as Research Rabbit. Research Rabbit is an AI tool to help us search for literature of review of literature. Now I typed into that two set of keywords. One is transfusion medicine, comma. Second one is artificial intelligence. So it knows the synonyms for both these subjects. So it searched the web and gave me a detailed list of all the studies in the field of transfusion medicine or something that has related to the blood transfusion with AI or machine learning or deep learning or artificial neural network, something like that. So as you can see, there are a lot of articles. There are 1,112 similar articles here. And it has shown the link between all these articles too on the right side. So AI is going to revolutionize everything. Now, in transfusion medicine, let's look at donor recruitment. So the first one is you can send personalized reminder strategies. For example, we each use different social medias. Some might use email, SMS, WhatsApp, or Instagram or TikTok. Now, if AI knows which is your favorite social media platform, it can send you a personalized message in that particular platform. If it's SMS or WhatsApp, you can send a small message. If you are someone who watches a lot of reels, AI can customize a reel video asking you to donate blood and push it onto your TikTok reels feed. Now, AI can do one more thing. AI can mimic your favorite celebrity, like Shah Rukh Khan or Tom Cruise, and ask like them as a celebrity to ask us to motivate us to donate blood. Now, there is something called as hemoglobin tracking and optimization technology. That means that if everything is connected, the AI will know when you last donated. It can track your hemoglobin. It can know when it's time for next donation. And it can give you personalized dietary modification based on that. It can help you keep your health better. Now, there is smart booking system. For example, so I want to donate blood. My blood group is ORHD positive. So I search Google and my nearest center is 5 kilometers away. Okay, now I ask specifically specific AI regarding where I should donate blood. So the AI will search my district or state. AI will know where I am right now. Now AI will search all the blood banks and the stocks, and it will say that there is another hospital which is just 5 kilometers or 10 kilometers away from my place, which currently has a bleeding patient who has a blood group of O RHD positive. So if you want to make an impact right now, the patient is waiting for my blood right now 10 kilometers away. I can just spend 10 more minutes and travel to that center and give it to that patient, and the blood will be used today itself. So it can also book for me according to my time of convenience. The AI will know what is my working time, when I'm in the office, when I'm in the free time, when I'm having my lunch break. It can schedule my appointment with the blood center information system like that. So it can it can be used for doubt clearing. Obviously, I have been using this for doubt clearing. We will type something into ChatGPT or Google, and it will give us the results. Now it has advanced communication skills. That means that whatever data the donor requires, it can be provided from the internet. Then there is something called as predictive donor engagement. Again, it's a personalized strategy. So AI has all our personalized data. AI knows what my job is, what my education level is. So it can alter the technological or jargons we use in the medicine and explain it simple to the donor. Now coming to the donor counseling, if AI has access to the electronic medical records, it can have all the history of the donor. Now for deferral criteria needs to hold huge amounts of data. And if you want to check what's the deferral period of dengue in India, or what is the deferral period of someone who has visited India and went back to the US, can they donate blood? All this data can be easily retrieved by AI from the internet. And it can go for international standards and compliance. That means that suppose I will not be able to know all the regulations and outbreaks happening across the globe. So there is some new disease outbreak happening in other side of the world. So the one donor has gone there and come back. But I do not know what is the incubation period of that disease, or is there a travel restriction, or is there a guide for donation? So AI can search that country's database and see which all diseases are prevalent there, if there is an outbreak that is not here in India, which is not tested in India, and it can give us international standards and compliance. So our blood becomes more safer. Then it's an immediate response about doubt clearing. So you just ask something, it will give you the data within 5 seconds. That's it. Then there is less errors. So there is error reduction. It avoids the human bias and shyness in donor counseling. I have seen counselors shy about asking history of sexually transmitted disease or the current sexual activity of some donors. So AI doesn't have that problem. If you properly train that AI can make the donor feel comfortable and ask the right questions and get the right responses. Now, something called as dietary counseling. Like I said, it can counsel the donor particular for their ferritin levels or the iron levels. Suppose the donor is a regular plasma donor, then also the AI can change the dietary pattern according to that. For more calcium, what you need, for more iron, what you need. And if any other vitamin deficiency has been detected in your medical record, AI can give directions for that too. Now, if robots can perform surgeries, why cannot robots collect blood from a donor? So there is no need to retrain staff each time one staff leaves for another institution or the designs. AI gives us no deviation from protocol. It has precision and standardization. And there are already wayfinder-like technologies, and this can be incorporated by AI into blood collection. Now for hemovigilance, once integrated with electronic medical records, it can do the classification of the hemovigilance or the transfusion reaction or the donor reaction for us. It has an intelligent grading mechanism. It can have the data of the donor, the unit, the test done, the data of the patient, the clinical history of the patient, everything is in one platform. And it will reduce the bias and errors in hemovigilance. Now coming to immunohematology, it's an intelligent antibody screening system. So once in a while, we'll get a discrepancy sample in blood grouping or antibody identification or ICT or DCT. It will give the result as invalid, and we have to interpret it ourselves. So we feed the database with hundreds and thousands of patterns that can interpret the blood group or antibody that currently we are using. So we use the 11 cell and the 16 cell panel, and we use the pattern recognition. So we use the rule of 3 to rule in 3, rule out 3, and assume it could be this antibody. So AI can do that pattern recognition much easier and faster than us. And if genotyping and phenotyping of the donor or the patient is done, it can very accurately predict which the antibody will be. Now, for inventory management, like I said, in the dengue situation, it can predict or demand forecasting. There is complex inventory tracking, intelligent inventory allocations, then supply chain optimization for not only blood, but also the blood bags, reagents, chemicals, whatever we use in the blood bank, it can be optimized with AI. Then there is something called as scenario modeling. For example, suppose we had a COVID outbreak. Now we can ask our AI, I am residing in this state. Suppose there is an outbreak of COVID and there is lockdown. What can we do to ensure the availability of blood? We faced such an issue some years back. We all of us faced that. So what AI will do is, first it will identify our location. We are in this particular state. Then we are in this district of the state. Now AI will search all the population. It will estimate the population of that particular region. Now AI will remove all those who are not eligible to donate. So if the age limit is 18 to 60, it will exclude all the other age groups. Again, they will check our electronic medical records for whoever is eligible to donate. They will rule out who has donated before their next donation interval. And they can access our Google Maps. All of our phone has Google Maps, so it will know where we are. They can access our Google Maps and see whether we have gone to any areas that is a hotspot for this COVID infection. So we might become a contact, or it can check whoever is in 5-kilometer or 10-kilometer radius of our hospital and who's willing to donate. And this AI can send push messages to these individuals who are eligible for donation and who is in vicinity of our hospital. Yeah, like I said, in the personalized messaging, it can be through SMS, it can be through Instagram or TikTok Reels, whatever method they particularly. So we just have to ask them to ask AI to do it. We don't have to do each step separately. AI will itself do all these things. Now, coming to patient blood management and blood transfusion, it's a holistic risk assessment process. It can predict the risk of the patient, how much the patient might need or might
I'm
not
sorry
need.
to interrupt, Dr. Arun.
Yeah.
Your slide is not moving. It has not reached the PBM. It's still at immunohematology slide.
Okay, just give me a moment.
Yeah.
So is the slide visible now?
Yes.
So it
Can you
can
just show
predict
the previous slide also? Just show because that also didn't come. Yeah, okay.
So inventory management, it can track anything. Demand forecasting, inventory tracking, inventory allocation, and supply chain optimization for blood and every reagent, even the micropipette or tips within our blood center. And for scenario modeling, just like for COVID. Now, patient blood management, it's a holistic risk assessment. It can predict the risk of bleeding or not bleeding. It can do the preoperative optimization. It can do real-time hemodynamic analysis. For that purpose, we need the real-time data of the patient's pulse, BP, temperature, the amount of blood loss. So if there is facility to monitor all these things, it can do a real-time hemodynamic analysis. That personalized blood conservation strategies based on that patient. Suppose the patient is a Jehovah's Witness, it can give personalized blood conservation strategies, and it can match that not only the units but the donors and the donor parameters to that of the patient. Like I said, a unit with equal volume but different hemoglobins of 13 and 16.5 will be having different hemoglobin concentration. So it can be given to a bleeding patient. Then it can guide us in massive transfusion also. Now, in the field of plasma,
the slides are not moving again.
Okay.
Yeah, okay, now it's there. Okay.
Now, in plasma-derived medicinal product, it can help us in donor selection and retention. So the criteria for whole blood donation and plasma donation is different. So AI can identify who is interested in single donor plasma donations or who is more suitable for plasma donation. and ask them to be regular plasma donors rather than whole blood donors. It can optimize the process with wearables to monitor their donor vitals. And inside the fractionation facility, it can pool and give better yields. It can help in manufacturing automation within the fractionation facility and the supply chain and distribution optimization for plasma-derived medicinal products. Now, it is also being used in quality control. So, metabolomics to assess storage lesions. It can assess metabolomics to very precise levels to assess the storage lesion, even with a smear of the red blood cells taken from the PRBC bag. The AI can take a picture and assess the shape of the cell and predict the storage lesions of that particular unit. Now, going for genomics and rare donor registry, the thing about next generation sequencing is that we have a lot of data and it's hard to process manually. That's where machine learning or AI comes into play. It can identify the genetic variants, and it can map the complex genetic interaction between these genomes. Now for a few examples. So, Tanvantri AI is a project done by Dr. Arun VJ. He's from India. He has done and is currently doing a project in evaluating retrieval augmented generation based AI model against conventional large language models in transfusion medicine. So,
Dr. Arun, again, we are stuck. Okay.
So Dr. Ronak Dubey has a project called Dhanvantri AI. So his model has achieved a mean score of 8.45 out of 10, which is significantly higher than a normal ChatGPT for 6.65. So if you feed into that Dhanvantri AI, the patient details and ask what can be done for that particular patient, that Dhanvantri AI is going to give us the very accurate treatment protocol and guidelines for that particular patient. So Dhanvantri is the god of medicine in India. So the only way to keep AI from taking your job is to use AI to do your job better. Is my slides visible? Is it moving?
We are at the Dhanvantari AI project.
Did it change now?
Yes, yeah.
So in China, there is something coming up. It's called as the agent hospital. It's said to be capable of diagnosing and treating over 10,000 patients. For a normal hospital or doctor, it would take about 2 years. So these AI doctors have achieved about 93.06% of accuracy. That's a very good accuracy, even better than a normal doctor. The hospital has 14 AI doctors and 4 AI nursing agents, which have simulated the real world medical practice. And this is the first step of having a comprehensive AI treating hospital. Now in US, OneBlood and Rexer Analytics, they have been successfully forecasting overall cross-hospital and blood order volume for years, and it enables OneBlood to right-size blood collection efforts throughout the COVID-19 pandemic. So they have already done it. So instead of focusing on the past orders, they are utilizing the current inventory levels and blood usage levels and using the average and variance to predict the current ordering levels of the blood. Now, in Canada, the University of Calgary, they have integrated machine learning and statistical modeling to optimize the red blood cell inventory. This strategy has reduced the inventory levels by almost 40%, leading to cost reduction of 43%. So it doesn't just make our work easier, it's also useful for reducing the cost of operations. Now in NHSBT UK, they matches the blood for ABO, RHD, and extended phenotyping, and they have a centralized transfusion system. So the donor unit may be far away from the patient. So when a patient gets admitted and their phenotyping is done or it's taken from the EMR, automatically the machine learning will identify the best suitable unit for that patient, which may be very far away from the patient, and it will make the best logistics decision to get that unit to that patient at the right time or on the day of the surgery or 1 day before that surgery, so that patient will get the right unit on time. Now, like everything, AI does have its challenges because it's in the initial stages. We are not stabilized yet. So the first one is technical challenges. So data quality and availability. Like I said, the food of AI is data. garbage in, garbage out. That means that if you give it false data, it will give false results. The internet is full of outdated, obsolete, and fake data or fake information. So if the AI is capturing all this data, the output becomes very bad. And the other thing is that availability in a developing country like India or other countries, our majority of our blood centers doesn't have a blood center information system. And therefore, all this data cannot be captured and given to AI. So for AI or machine learning to be active, it needs a blood center information system where it can capture the data. Now, the complexity of biological variables. Each individual is different, and we have to consider individually each patient's parameters. That's what is called as patient blood management. So AI has to be trained so well that it has to identify each patient's parameters correctly. Now, we have to integrate with existing systems, which is not very difficult, but it will take some time. The other part is ethical challenge. So patient safety and trust. The thing about medicine is that we like being consoled by a doctor. We want that human touch. For a patient to trust a robot to do his or her surgery is going to be very difficult. So patient safety is of utmost importance, and the patients and the doctors must trust AI. Then there can be biases in algorithm based on its program. Now there are regulatory challenges. Like I said, still AI is in the early stages. So there are lack of established guidelines, and nobody is telling how do we validate an AI. When can we use it for patient treatment? If you use it for patient treatment and something goes wrong, who is held responsible? So the regulatory challenges are still there. Now, the other one is the operational challenge, training and expertise. It was very difficult to get my staff to be proficient in using a normal computer and Excel sheet. So imagine training an AI. The doctors has to understand how an AI works. The AI has to understand what a doctor does. Now the technician has to know how to train this AI model. So it's going to be very difficult training. Then there is cost implications. As of now, almost all the softwares, even the one ChatGPT has a free version, and there is a paid version. When it comes to healthcare, it's a money-winning business. So we'll have to see how the cost implications will be in the future. Then the last part is the change management. Obviously, we are very recommend for change, and it's going to be very difficult when AI interferes with our work. Now, as the last part, Geoffrey Hinton is the godfather of AI. He used to work for Google last year in 2023. He left Google and he warns all the dangers of misinformation. You must understand the problem. If the godfather of AI itself is warning us about the dangers of misinformation, then what are we supposed to do? What's there to worry about? Now, this was from the flyer of the webinar. So if you had asked me how I had created this image, actually, the one you see on the left was my image, which was taken 5 years back. So just for fun, I used AI LinkedIn professional headshot generator to create this image. So this one is a 5-year-old. I asked it to a Canva to create a image in which I am in suit. Now, apart from the medical part, let's just discuss a few minutes about some AI tools and prompt engineering. So prompt engineering is the process of creating instructions to tell a generative AI what to do. So the goal is to get the AI to produce the desired response. I will show you with an example. So this is the Edge Copilot or the Microsoft Copilot. I had given the question, what is Transfusion Medicine Academic Society? It's a society or the organization that is hosting this current webinar. And it gave me one paragraph result. Now, I tweaked that prompt by a little. I asked it, I have an upcoming presentation on Transfusion Medicine Academic Society at an international conference. Give details on what I can present on TMAS. So now the Copilot understand what the scenario is, how much data I will need for a conference to be presented. It has structured itself. It has given headings and subheadings. Now it has given in brief introduction, the background of TMAS, the key objectives, the major activities. In the further slides, it has given the office bearers and the list of the latest webinars conducted by Transfusion Medicine Academic Society. Now, research is something integral for transfusion medicine. All of us transfusion medicine specialists must have done some kind of research or doing some research or planning to do some research. AI can revolutionize and already has revolutionized research. So these are some of the tools that we can use. For brainstorming, you can use ChatGPT, Claude, Gemini. For literature review or finding articles, Research Rabbit. Research Rabbit was the one I had used for reviewing literature for this particular webinar. Literature review and writing, again, ChatGPT, Claude. And if you are submitting this thesis to your professor, and if the professor wants to detect whether you have used AI to write that thesis, he can use GPT-0. Now, if you don't want your professor to find out that AI is there, you can use AI content removal tool, which is called as Quillbot. You can, when submitting to the university of your thesis, you can use plagiarism removal tool, again Quillbot for that. For reference, there is Zotero, and it can be integrated with Research Rabbit. Then there is some applications for image generation, which is ideogram. The images can be generated using ChatGPT or Gemini, but ideogram has very good image generation program. So their images are way far better than any other ChatGPT or Gemini. Now, AI PowerPoint presentations. Like I said, the first slide was created by Gamma. Magic Slides is also a very good one. Now, let's just briefly look at PPT generation. So the keyword I gave for this one is AI in transfusion medicine. It has given me this first slide. Gamma is a paid software. In the free version, you are able to get 8 to 10 slides. More than that, you need to pay for that software. So I use the free version. So second slide is challenges in transfusion medicine. It has given the heading. It has given the subheadings. Now in the third slide, how AI can help. It has again given an image, subheadings, and it has into 2 columns. Next slide, automation of blood typing and matching. There is a robotic arm automating everything and small picturizations in between. It has given a flow chart, graph, and numbered it. Now there is another image of a slide, the microscope, again headings, subheadings, natural language processing for clinical documentation. As you can see, if you see the lady doctor's hand, there are 6 fingers on that hand. That means to say that you cannot trust AI always. There will be some error from the AI's part. Now it has given some diagram, transparency, ethical considerations, privacy, security, bias mitigation. So the thing is that AI can do almost any job. The bad thing is that AI can do my job. That's the bad part. As doctors, we are somewhat safe, but still we are not that much safe. So if you want to get yourself acquainted with AI or get a brief understanding about how AI works, this is a Coursera offers free AI workshops. It takes about 1 to 4 weeks. There are other free courses also. You can just go through its beginner level. So it's easy, divided into different courses, and it's free. Just sign in with your email ID or Google account, and you can go through these classes. This is AI in particular to healthcare or medicine. Introduction to AI. IBM is offering free courses. These are free courses actually. Now, as for doctors and transfusion medicine, ultimately the essence of providing healthcare will continue to revolve around empathy, compassion, and human touch. That will never go away. The AI is just a tool created to augment these qualities. Now, those who are able to embrace this paradigm shift will find that they are able to use their skills and training to cure sickness and improve patient lives in ever more rewarding ways. So embrace this shift, use AI tools, get yourself educated. With this, I would like to conclude. Thank you for your patient listening, and thank you, TMAS, for giving this opportunity.
Thank you, Dr. Arun. It was a wonderful presentation. So before we come to a halt, there is one question in the chat box by Dr. Meetu. 1 second. Is the image generated through AI softwares copyrighted? Dr. Arun, please take over.
Yeah. So at the moment, it is not copyrighted because for it to be copyrighted or patented, it has to be provided by a human being. It has to be produced by a human being. So even though you are giving a prompt, the image is generated by a computer. So as of now, it is not copyrightable. But as I said, the regulations are not yet complete or it's evolving. So in the future, we'll have to wait and see when some litigation comes, how it will be going.
Okay, is there anything else anybody else would like to ask or raise
I
your
think someone has
hands
raised
or
a hand.
something? Yes, one second. I'll unmute you.
Hello, Mike.
Yes, please unmute yourself and talk.
Okay, so there is one question from Dr. Mohan Bose. How to humanize AI-derived content to escape AI tool check? Okay, so that's what prompt engineering is about. You have to give AI the context in which you are going to ask that question. Suppose you want to, so it goes like this. There are different heads for AI. You have to tell it what head you're activating. For example, if you want to generate a title for your research, you will first tell it, assume that you are a veteran in the field of research in transfusion medicine who has published multiple papers in national and international publications. Now, you are trying to do a research of AI in transfusion medicine in a tertiary care center in South India, which has a blood center information system, but limited access. You can say that you have access to EMR, or you do not have access to EMR, or you can say your patient population, your hospital, a cancer center, or it's not a cancer center, or you can say almost all your patients are insurance patients or the government hospital. You can specify it like that. Now you can come to the third part and say, now brainstorm or generate ideas or research titles for that particular idea, AI or something in transfusion medicine, and see. So it will be different rather than giving just 10 ideas in transfusion medicine. And you keep on tweaking that prompt using prompt engineering and get the desired result. Okay. Okay. And there's another question. Will electronic cross-match come under AI, or how is it different? Okay. So electronic cross-match, I'm sure you might be all known. As of now, I don't know how many centers in India has access for electronic cross-match. So AI will be different, because if AI has access to electronic health records, not just ABO, RH, and phenotyping, it can take previous histories of transfusion, any previous antibody detected, and if for some reason your genotyping is done, all the genotyping data will be available for the AI if it has the consent or access. Then cross-matching will become new, entirely different. It's a very advanced cross-match that it can, our PRBCs and the patient can be matched on a genetic level. I hope that, see, it's a new field, so that how it will come about can only be told by time. Another thing is, there's another question from Dr. Srivastava. Can plagiarism detection softwares like Turnitin detect if the AI, if the research or thesis work has been done by using help of AI? The funny thing is that I'm currently undergoing an MBA program, so I have to do a project, and I'm going to be submitting it in the next coming months. And they have asked us to use Turnitin and generate a certificate that it has less than 25% plagiarism. So definitely Turnitin has the potential to detect AI. I'm not sure because I am yet to use it, but it's easy for Turnitin to detect AI plagiarism.
I think I can contribute to that. Yes, Turnitin will detect AI generated work, research work.
So I had shown you some software, GPT-0 to or Killbot to remove AI-like content. So you have to use that software, or the best solution is to rewrite after reading that paragraph. That's the best way to avoid plagiarism. So the plagiarism usually checks for 3 words. So if a software is checking for plagiarism, it will take 3 words, bits of 3 words, and see if the 3 words is there somewhere on the internet. So while rewriting something, it will definitely mix up all these things. We will definitely mix up all the things. There will be grammatical errors. There will be spelling mistakes. So AI will never make a grammatical error or a spelling mistake. So it's not, I'm not supposed to say it, but if there is spelling mistake in your thesis, the AI or Turnitin will think that it's man-made, or you have written it.
Okay, so we have one more hand raised. I have unmuted you, Saumi. Can you please unmute yourself and talk?
Hello, Dr. Arun. Extremely
Hello.
good presentation. So I just wanted
Thank
to
you.
ask that the blood bank softwares that we use currently, can those be categorized under the AI models of learning and whatever it is? Maybe pretty primitive, but I mean, the benefits regarding inventory management and suggestive, predictive, suggestions regarding blood utility and usage and all, that's all pretty much being covered by our current systems anyway, right? Would that still be considered as AI? Would that come under the definitions of traditional AI?
Yeah, so like I told, AI is a broad term. It has machine learning as a subset under it. Majority of our centers are using actually machine learning for inventory management, not AI as such. So if it does more than what machine learning does, and it predicts more than what a machine learning does, it mimics our human behavior and takes the data from internet and gives you suggestion that there is a dengue outbreak or there is a COVID outbreak and there is supposed to be a festival or your stock is going to get low, then it becomes an AI and it will come under AI. Otherwise, it's machine learning that is coming under the broad ambit of AI.
Okay. So, and also of the various models that are talked about under AI as such, at the broad spectrum of AI, what are the models that are relevant for us? And could you please explain to them just a bit in brief that what are the models that are relevant for us in the context of transfusion medicine? They never really become very clear to me. I just get the terms. I think I understand them, but I'm not very sure what they are exactly.
See, it's not a fixed model. Anybody can create an AI model. That's the main. That's what Dr. Ronak Dubey has done. He has created a Dhanvantari AI model. If you feed into it the patient details, a 56-year-old male patient, he came with this complaints. He's currently bleeding. His hemoglobin is this much, platelet is this much, PT, APTT, INR is this much. What is the treatment protocol for that particular patient, for that particular surgery? So that's one active one that is available right now. Again, it's all hypothetical situation. I'm not sure in India if there are other AI projects, and I was not able to find any other very good AI project. There are some machine learning projects currently going on, which predicts the requirement of platelets and PRBCs. Other than that, right now, I don't think not much is available. The studies are still undergoing or unpublished data, so I don't think I can comment on that.
Okay. So other than I mean, I have spoken to Dr. Dubey very sporadically, and I have seen his presentation at TransmedCon and all also. So other than whatever he has published and whatever areas that he has worked on, that's all the research that has been done so far on AI right now, right?
Yeah, the thing is that if you just go to the website called Research Rabbit, and when you sign in with your email ID, it will ask you to type in the keywords. You can type in machine learning, comma, AI, artificial intelligence, comma, transfusion medicine, comma, blood. It will give you published list of published articles. There are a lot of studies, mainly in inventory management. For a particular, like for particular surgery, the patient is undergoing hyperthermic intraperitoneal chemotherapy. Can AI predict the requirement of cryoprecipitate, or according to the patient parameters? The patient might have undergone a surgery before, so there may be more adhesions, and HIPEC is known for causing massive transfusions. So based on that, some have done studies on that for gastrointestinal surgeries, on gastric varices that bleed too much. So studies have been conducted. If you go to the Research Rabbit, you can find all those studies which have already used AI or machine learning models.
Okay, could you please put that in the chat box? just how to find those studies? That would be helpful. Thank you so much.
Okay.
We have one last question. Uh, if AI makes a medical error, who should be held responsible?
Yeah, that's what I told. As of now, the regulations are not very strict, and AI per se has not been, I'm not sure, has not been used for patient treatment on 100% reliance. Always there is a clinical interpretation or a doctor is involved in the loop who verifies the data or the guidelines given by AI. So we have to wait for a litigation to come, and it has to go to the court, and the court has to decide who is responsible. Obviously, there has to be one doctor who verifies the orders of the AI, and most probably that doctor will be responsible. I'm not sure. It has to go to the court, and we have to see the verdict.
So I think we can come to a halt with this. It was a great presentation, Dr. Arun. It was very informative, and a lot of participants actually participated. Nearly almost 197, 99 it reached in between. So a huge round of applause for the effort you've put in and for the dedication with which you brought out this topic to TMAS webinar. If there are any more queries, you can contact Dr. Arun personally. Thank you very much. Thanks everybody for joining and being a part of this. Thank you. Have a great evening.
I have given my email ID. So if there are further queries that I can help with, please mail me. I will try my best. Like I told, I'm not a software engineer. I'm a doctor who's just interested in artificial intelligence. That's it. I do run my own blog. I use AI on a regular basis to generate images and prompts AI to give me ideas. I use AI to generate ideas for my blog too. So I have been using it for the past 2 years since OpenAI has launched ChatGPT. So I will help in whatever capacity I can. And I will take this opportunity to thank Kimas for giving me this opportunity. And it has been a great experience. I was very unsure about presenting on a topic I have no idea about. Thank you so much.
Also, there is a link for the certificates in the chat box. Kindly fill it up so that you can get the certificates. Thank you so much.
Okay.